Good morning and good afternoon. Welcome to the Weekend Wellness Hour show. I am very excited to have someone I just became very familiar with, Dr. Stasha Gominak, who is a Harvard-trained neurologist and a leader in neurotransmitter-based treatment of sleep disorders. We're going to go through what all that means, and she is going to share with us what is going on in the world of sleep and how we can help ourselves. So I really appreciate you, Stasha, for coming on today. Thank you so much.
Thank you for inviting me, Amy. I'm so enthused that you're interested.
Yeah, absolutely. And I'm really curious about your background. We know where you were trained a little bit, but can you tell us how you even got into this field? I know you have a little bit of story behind it as well. So if you could share with us on that.
Okay, so my training was as a neurologist, and I practiced as a general neurologist, and peripheral neuropathy was my specialty. I was not trained in sleep, although I am able to read all the journals, and I'm very interested in sleep. I was not trained in sleep, and I fell into sleep as an accidental event. So I moved to Texas with my husband in 2004. I had been practicing in the Bay Area, in San Francisco Bay Area. So I had half of my practice in daily headache sufferers. And I'd been doing that in California too, not because I was good at it, because I don't think there is anybody who's good at it, but because they wind up going from neurologist to neurologist, and they're pretty desperate and nobody really understands how to make them better. And we try all these things. One of them had used the medicines that I gave her, but didn't have any relief, and said, I think I have a sleep disorder. My husband says I snore like a train. And she was, this is in 2004. So this is almost 20 years ago. And at the time, she was young, healthy, didn't have a fat neck. She was in her middle 30s. There was no reason why she should have sleep apnea. We were not being told to look for sleep apnea in that population. And frankly, I didn't think sleep really was applicable to my patient group. So I sent her for a sleep study. She turns out to have sleep apnea. She puts on this torture device, and she comes back 3 or 4 weeks later saying, my headaches are gone. And I was just blown away by that, because I have this very biochemical view of how the brain works and what migraine is like. And I've been doing headache for a long, long time, and my medicines are supposed to work. Yet I also know they don't exactly. They wear off, they're temporary. And so she puts on this torture device that, in my view, can't have a placebo effect, okay? You cannot strap on one of those things while you're sleeping and go, oh, this is wonderful. Nobody wants to do that. Her headaches went away. So that started a journey where I thought, I got hundreds of other patients with daily headaches. I'm just going to start doing sleep studies on them. And if they have sleep apnea, I can treat them. Well, they didn't have sleep apnea. Most of them did not. So this population is young, healthy females. Most of the people with daily headache are young, healthy females. They've had a couple of kids. That's about it. I started doing sleep studies on little kids with headaches, teenagers, and some males. And as I start to do more and more sleep studies, I realize, and it takes a while, they don't have sleep apnea, but they don't have normal sleep. And that takes a couple of years before the pulmonologists, so that it's the lung doctors, because they were on the machines, that had gotten into the sleep apnea. That means when you don't have the right phases of sleep, but you don't stop breathing, they just don't put it on the report. Okay. My pulmonologist says to me, hey, I don't know if you've noticed this, but your patients don't have as much rapid eye movement sleep as they should have. And sometimes they just stop breathing in rapid eye movement sleep. And I'm like, well, that's not on the report. And he says, yeah, I know. And I'm like, wait. Mm-hmm. I've sent you hundreds of people. Their sleep studies are abnormal. And you've sent me a report that says no significant apnea. That means I have to really completely change the way I'm thinking about it. So it started with apnea. But now that I've done hundreds of sleep studies, and these young, healthy people have a very specific finding. One, most of the time, their complaint is, I wake up at 3 a.m. and I can't go back to sleep, if they have a sleep complaint. The second complaint is, I sleep, but I'm tired. So they aren't snoring. They don't have the typical things that would alert them to having a sleep disorder. They just don't feel as good as they used to. A lot of them are heavily trained, long distance runners, CrossFit, They're doing all the things that everybody's told them to do with their diet and their exercise, but they still feel tired, or they can't remember, in a bad mood. They just don't feel as good as they think they should. And because sleep has been ignored, and because we're unconscious during it, it's been left to last. So now I have hundreds of sleep studies in young, healthy people who have a relatively uniform abnormality, which is they don't have the right amount of deep sleep. Okay, nowadays we have trackers. It's a little confusing because the sleep experts call any paralyzed phase of sleep, which includes slow wave sleep or REM sleep, as deep sleep. On the trackers, they've used that name to refer to slow wave sleep. So the first half of our sleep has a specific kind of paralyzed deep sleep called slow wave sleep, and it's called deep sleep on the trackers. The second half of the night has another deep sleep. Both of those we get paralyzed. That's the other thing that just went, paralyzed. That's really creepy. Ooh, how do we do that without dying? And I was having other people's sleep studies that would be, they stop breathing 60 times an hour, okay? Every minute they stop breathing. And I'm thinking, animals have been sleeping for 250 million years. This part of the brain, this is called the reptilian brain. It's the brain stem. That's the lowest part of the brain. That's where our sleep switches are. That is exactly the same in a dinosaur as it is in us. It hasn't changed one bit. That means it's been successfully allowing dinosaurs to sleep, and every other animal on the planet sleeps normally. We're the only dummies that are wearing those CPAP masks, okay? And only a doctor would come up with something that wacky. That means, oh, this is very complicated, but I don't have to figure out everything. I just have to figure out what went wrong, okay? The whole idea that someone could stop breathing every minute while they're sleeping means there's a huge mistake in an engineering diagram that's been working for millions of years. That's fascinating. Yeah. Ultimately, I used CPAP devices. I wound up using a lot of sleeping pills. I was very frustrated because no one else is writing about this. But to me, if you don't get into a certain phase of sleep and you don't stop breathing, it can't be about this. We've been all looking at the airway. It's not wrong to look at the airway. It's important to look at the airway, but it's not the only piece that's playing a role. So about 5 years into it, I had a young 18-year-old. So I'm reading all these nerdy articles, and for the first time, I'm really thinking about the sleep switches, the nerve cells that are running our ability to become unconscious and get paralyzed and then not be paralyzed. They have to turn the muscles off. Well, why would they? Well, maybe we do that so we can repair them. And maybe that's, remember on those sleep switches, what we see is sometimes they stop breathing, but sometimes their legs are kicking. And a lot of these women have knee pain or ankle pain or back pain or hip pain, and they really shouldn't. They're 32 years old. That adds a different way of thinking about it. Maybe this pain is because their limbs are still moving when it's supposed to be paralyzed. Like, it's kind of creepy to get paralyzed, but there's got to be a reason. So maybe they aren't healing completely, and there are certain parts of the body that are more affected than others. So I'm thinking now of this controller, like little dials in the brainstem. And I'm reading these articles about how we get paralyzed and what chemicals we use to get paralyzed. And now I'm thinking of sleep in a single cell, which is really peculiar, okay? I'm telling you this because I got there in this over a period of years, but it is a weird way to think of it. And then I have a client who's 18, and she has a sleep study with me because she comes in with daily headache. She has 8 solid hours of sleep, but she never gets to any deep sleep. There's none. And every 2 minutes, 35 times an hour, she goes from sleep to light sleep. So it looks to me, having done this for a long time now, that every time her brain tries to flip into deep sleep, goes right back to light sleep, right back to light sleep. Light sleep is still asleep. So as far as she's concerned, she slept for 10 hours. Okay. There's nothing wrong with her sleep. If you say, hey, Vanessa, how's your sleep? She says, it's fine. But I'm seeing inside the sleep, realizing that She is not healing anything. So her headaches went away with my medicine, but I'm looking at a sleep study going, this is really bad. I don't know what's causing this. So she says, I'm so tired. My headaches are gone. Is there anything you can do? And I say, I don't know anything about tiredness, really. And so we do a B12 level in a thyroid study, and her B12 is very low. In the past, I would not have alerted to that, but it was low enough that it actually said abnormal, which turns out to be relatively rare. And because I was telling you about this, thinking of it as a single cell, I'm thinking, wait, I don't know what that stuff does, but I think we need those little vitamins to do all these biochemical pathways. And maybe this cell that's supposed to be paralyzing us and flipping us into these phases of sleep doesn't have the raw materials it needs, which is a completely different way to think of it. The idea that you could have a deficiency state that could be global. I mean, first thing and most important, this is not affecting just my population. These are sleep studies around the world now. And for 5 years, I've been deeply into this, and I realized, no, this is impacting everyone. I happen to be looking at a young, healthy population, but every single person I see in the stroke, when I see work on the weekends, every single one of these people has sleep disorders, and sleep apnea is just a tip of the iceberg. And I got all these little kids who have abnormal sleep. This is terrible. What's going to happen to them? So now I've got a sense for how incredibly common this is. The second question would be why? Because I know this was not the case in the 1960s, 70s. When I was in medical school, I was in the San Francisco Bay Area. The original sleep studies where we first started were in the 60s and 70s. They were at Stanford. They were really done on Stanford medical students and Stanford college students. This epidemic did not exist then. Okay, so I've lived before and after, and also seen all these other diseases become epidemic. Why is ADHD being seen in huge numbers at the same time that there's a sleep problem that's 80% of the population? Are they related in some way? So there are all these things that older physicians kind of go, oh, that's bullshit. I mean, that's not a real diagnosis. And we think that because the things that started showing up in the 80s, fibromyalgia, chronic fatigue, ADHD, those are diagnoses that we haven't really clarified completely. And they all started to show up after we graduated from medical school. So there's sort of this historical timeline going in the background in my brain. Now, B12 turns out to have a big history of helping with sleep. There's a whole literature about it. So I just start to do B12 levels in all these people who have daily headache. And it turns out that the B12 is low in the really, really sick ones, but not all of them. In about the third week of doing that, somebody mentions to me, hey, my doctor did my vitamin D level. It was low. She gave me vitamin D and my wrist pain went away. Remember how I was thinking like these movements, these CPAP devices, they don't help with these extra movements. They just blow air up in the nose. Yeah. So we still don't have a good answer for how these increased movements affect us. So I think, well, that's what I'm thinking about when she says, oh, vitamin D made her wrist pain go away. And, I know nothing about vitamins. I've been trained away from them. So I happen to say, look, I'm drawing blood anyway. Let's throw the vitamin D level in there. So it's completely by accident. I'm absolutely naive. And if I knew then what I know now, I think I would have been scared, actually, to go down this path. But at the moment, I have nothing to offer these people. Sleeping pills work for a while and then they don't get better. But getting to sleep better helps their headaches, helps their memory, helps their mood. So now I'm like a sleep maniac. I'll talk to anybody about sleep. But the problem is that we don't have an intervention. We have sleeping pills, which we're all satisfied with, and we have this CPAP device, but we don't have an answer for why these people would be having a problem, especially somebody who sleeps 10 solid hours, but the chemistry clearly in the background is so screwed up. Yeah. So for 4 months, again, by accident, between August and December of 2009, I'm doing a B12 and a D level on every single person that I've got in my practice who's had a sleep study. They have all sorts of diagnoses, but probably at least 50 to 60% of them have daily headache. And all of their Ds are low. And I'm like, well, this is weird. And it's at the end of the summer. Like if it got it, this is the highest it's going to be all year for them. And we're living in Texas. Theoretically, we have lots of sun.
Yeah.
And whoa, this is weird. And I'm not alerting to it in any way because it's a bone vitamin and I don't care about that, except that I'm writing these lab slips every night saying, you know, you don't have a vitamin B12 deficiency, but you have D, take this D stuff. And then in December, 2 guys come back in the same week and say, you know, you said this CPAP would help my headache and it didn't, but you sent me that note the last time I was in here and you told me to take that vitamin D and I did. And in about 3 weeks, my sleep got better and then my headaches went away. 2 guys tell me that in a week. So I think if they hadn't, and it was kind of chancy because they happened to have D levels that were a little higher because they were outside workers. So with that, and with no other answer to give all of these people, I go to PubMed and put in a search terms. This is in December of 2009. And I put in sleep and vitamin D and there are 0 hits. No articles written at that time. There was an article written in January by a guy in Shreveport, just down the road from me. But the next search terms were vitamin D in the brain. And I stumble into a guy who's been writing about vitamin D, where the vitamin D receptors are. So if the vitamin D does something, it has to have a D receptor. And he has written about these nuclei, the nucleus pontus reticularis oralis caudalis, this long stripe of cells in the brainstem that no one knows about, okay? I'm a neurologist, I don't know about it. This guy has actually shown that there are vitamin D receptors in the sleep switches that make us paralyzed. He's shown that there are vitamin D receptors in the switches that run the clock. So the clock is about what time do we fall asleep? How do we coordinate these changes in the ratios of the neurotransmitters over an 8-hour span, really over a 24-hour span. So when people say, gee, your circadian rhythm isn't okay, what they're talking about is really light comes through the eye and coordinates our brain linked into a 24-hour cycle. That is very well publicized, okay? And that actually is linked to a vitamin 2 because it goes light, eye, retinoids, vitamin A, pineal gland, and then those messages have to be coordinated to a switching system that says it's 10 o'clock, time for you to go to bed. And then it puts out these chemical mixes that say drowsy. It's a warning phase. So we perceive it as, oh, it's time for me to go to bed. But it really happens all of a sudden, like you're not sleepy and then you are, and then you're not asleep. You're just sleepy because all of a sudden, Amy, you're about to be paralyzed. You better be in your little nest before that happens. So it's thinking about sleep as being one, heavily coordinated to the clock. And it turns out vitamin D is heavily imbued in the clock. Why? The guy that I stumble on is a guy named Walter Stumpf, and he's already written 30 years, starting in the early 80s, that this is a second hormone. A is actually a vitamin, but it's also a hormone. We do get it in orally. D is a hormone that we make on our own skin when we're in the sun, and it coordinates us to the winter-summer cycle. That means if you've ever heard about the concept of hibernation, there has to be a way that we link what our body does in the winter to the fact that it's winter. How will we do that? Well, Walter clarifies the whole thing and says, well, it turns out this particular wavelength that makes this hormone on our skin goes away in the winter sunlight. UVA is still there, but UVB is not. So this is literally millions and millions of years old. This D stuff started in fungus. It was a different D, but that means it's maybe billions of years old. So it's a hormone, and he has already put together an explanation for, oh, what are the things that you would like to link to the seasons? Fertility. If you don't have any food because it's 4 feet of snow and there's no way for you to get any food, you don't want to have your babies then. Oh, would you like to sleep longer and lower your metabolic rate so you can survive the lack of food? Yes. So then he shows that all these different parts of the body. So he has articles about, he's starting to write this in the 80s. And this is before the vitamin D epidemic of low vitamin D. At the time, the dermatologists in the 80s are just starting to say, sunburn is bad for you.
Yeah.
Now they've become so radicalized that being in the sun is bad for you. That's insane. It turns out they are not able to focus on the fact that their protecting of their organ, the skin, has led to these horrible outcomes because we were meant to live out in the sun. Every animal lives out in the sun, okay? Being outdoors is not just about D. It is about multiple other wavelengths of energy that were there since the beginning, okay? This world is not about humans. It's about hundreds of millions of other animals, and they've all had these biologic processes, and we're the dummies who went indoors, exaggerated even more by COVID. So he's already written this entire belief system about, well, when D goes low because we go inside, then we should have troubles with infertility, more troubles with mood. We'll have this, and this about our ability to repair our body. He hasn't written anything about sleep because he's ignored it too, even though he's written about these nuclei that are about sleep. So I actually read all of this during the Christmas break. I call this guy up when I go back to work and I say, hey, you don't know me. Luckily, he's retired and he's quite elderly now. So he takes my call and I say, you don't know me. I'm just a neurologist, but I have this clinical observation that every single person that has a bad sleep study has a low vitamin D. And has anybody written about it? Because when I put it in the PubMed, and he says, no, they haven't, but it makes perfect sense. It runs hibernation. So one, this guy is brilliant. He has already figured this all out. He's gone to the vitamin D meetings. He's very arrogant for good reason, but he's still very arrogant. And it turns out they would not accept his belief system about vitamin D because they didn't like him. Yeah. And here I am thinking, I can think of hundreds of patients I've had over the last 30 years that I've been practicing. This guy's writing these articles. I should have learned about this in medical school and in residency, where endocrinology took responsibility for this hormone and actually learned about how it fit into our biochemistry, how it fits into all of the other hormonal cycles, how it fits into thyroid, how it fits into the sexual hormone cycles. Why is it everybody has low T? It's not just because they have sleep apnea. Vitamin D either makes you very fertile because D comes when there's sun, which means there's food. That means you're fertile. You actually have babies and you can feed them. So there's a connection here that has all these logical little conclusions that you come to if you look at it through this lens. No, vitamin D is still a stupid bone vitamin, and it's not a vitamin anyway. And all of the literature now, because medicine started to say, okay, we're not responsible for vitamins. That's for lesser humans like dietitians, females, of course, in the 80s. And actually, that's when the vitamin D was starting to go down. That means the population before the 80s didn't have D deficiency in the sort of numbers that they do now. It had existed then. And if we have time, we'll talk about what that looked like. But it wasn't an epidemic. So that means when the medicine said, if you have a good diet, you don't need vitamins, they were kind of right. You'll see why they aren't completely right. So I step into this by accident. Walter and I write an article that's really a clinical observation that's based on seeing, okay, if every single person in my practice has a low vitamin D, is there a vitamin D blood level, not a dose? Because this is a hormone. You don't just say, hey, Amy, I think that your hair loss and your nervousness is due to thyroid. Why don't you just run down to CVS, buy yourself some thyroid hormone, and I'll see you back in a year. Let me know, okay? I use that example because even lay people know, well, wait a minute, my aunt, her thyroid got screwed up and she was all messed up when it was too low and too high, and they had to do all these levels and adjust. That's true for every single hormone. You have to know what you're doing. It's really kind of touch and go, and you have to do blood levels. So I do all these blood levels knowing nothing about this. I am not an endocrinologist, therefore I'm not trained in it, but it becomes pretty obvious that when my patients come back, I say, how's your sleep now? And they go, terrible. And I'm like, oh, bummer. What, are you taking that vitamin D? Yeah. Well, let's do your level again, okay? As a neurologist, I'm not doing levels of much of anything, okay? So they go down there and their level's still 40. And I'm giving them 10,000 IUs a day. And we're both going, whoa, what does that mean? Okay, everything on the internet is about you don't absorb it. And that's a lie. They're making that up, okay? Now, that was frankly one of my difficulties with this. As I do this more and more, I realize most of this stuff is just made up. Like, they just made it up. I was so offended by that. I was offended by the fact that the pulmonologist told us that, gee, the medical problems that are associated with sleep apnea are because the oxygen drops. That's not true. In fact, my patients, none of my patients had drops in oxygen. They were much less affected. But that means if they made it up, then I can make it up. You know, I can come up with a better idea. And if we're faced with, one of the problems with this field is there is a huge fight in medicine about D. Huge. It's really become politicized and angry and weird. Like, how could you get angry about teaching someone about a hormone of our body that has an incredible scientific literature for the last 40 years? The scientists are all excited about this. It's in every part of our biochemistry. The clinicians are being taught that they should avoid talking about it. Like it's bad, like, because it has a vitamin word on it. Like, how can it be dangerous to educate yourself? It's a very bizarre, you know, I've been in medicine for 30 or 40 years. I respect medicine. I respect doctors. So it's a really weird place to be. But this particular chemical, I believe, because it was called a vitamin, is being actually discouraged. We're discouraging physicians from learning about it. That means that the lay public knows more than their doctors, because the lay public is suffering. The people who wind up in my courses who are MDs are the ones that have sleep disorders, and they know that sometimes they're sleep experts, and they know that everything that they're reading about does not answer what is wrong with them. Nobody talks about insomnia. Nobody talks about the chemistry of insomnia. So in the background, I'm stuck with this very fraught, politically dangerous D stuff, which at the time I really I couldn't think that that could actually happen. I just thought people didn't know about it, you know? And I thought, why didn't I know about this literature? Why hasn't this been accepted? And I actually ended up going down this path of talking to the other big dogs in vitamin D literature about why didn't the rest of you accept Walter Stump's point of view? And they basically told me he was an arrogant asshole and we didn't like him. And he would stand up at these meetings and say, you guys don't understand this. And I thought, you know, he was right that they didn't understand it. And there are still some issues around D. So I'm telling you that part because if you sit in on this lecture and say, I'm going to take vitamin D and I'm going to talk to my doctor or whatever, it's not quite as simple as that. It's a little bit complex. Now, I'm going to stop for a minute and see if you have any questions for me at that point.
Well, yes. I mean, there's tons, but I'm curious. So what happened with that one patient whose vitamin D levels was still 40 and you were giving 10,000 international units? You have me captured. So we have to know the answer.
Okay, so I'm taking vitamin D. They're taking vitamin D. I have no idea about dosing. There's a guy that's got a website called the Vitamin D Council who actually made it available for testing by lay people. So the important part in the background is you can get your own D tested anywhere in the United States, except for 3 states. It's $39. It's cheap. There are some really specific things you have to know about which test you want to get. But there was a website that the psychiatrist in California had established. That was my only teacher. And then I just started giving higher doses. And it was quite clear that as the vitamin D blood level crossed over 60, we all started sleeping better. And I was like, wow, this is weird. So this is a clinical observation. It's uncontrolled. I'm not a scientist. I don't want to be a scientist. I want my patients to get better. So, but there was this consistent feeling once it got over 60, and between 60 and 80 is the right blood level for better sleep in someone who's had a sleep disorder. That does not mean that it's the ideal level for humans. It means that if you've been so screwed up by having bad sleep that you wind up in a neurologist's office with something wrong with you, or if you have medical problems because related to this sleep disorder, you have to get your D level to be 60 to 80.
Okay.
That has consistently stayed the same. Okay. My problem is I don't have anybody except me who's been doing this for 12 years,
Yeah.
but it's consistently stayed the same, that 60 to 80 is the right place for good sleep. What are the D levels that everybody's recommending? It depends on the person. They have no basis in science for any of the recommendations. If you're lucky, they actually recommend a blood level. If you're unlucky, they recommend a dose, which is incorrect. Every single person has a different level of deficiency. That means their need for that vitamin D depends on how incredibly depleted their cells are. Some of my patients had to go up to 30 or 40,000 a day. What we've been told is, oh, fat people need bigger doses. That's also completely incorrect. And also that, oh, they're not absorbing it. But if you follow that patient over years, what you will find is as they get better, in the third or fourth year after they're actually going back to work and they're sleeping better and their pain is gone and their gallbladder disease went away and all these other things, now all of a sudden they're on too much. And then they drop down. That means that their body was actually sucking up the vitamin D into every cell and using it. That means that person who takes 30,000 to maintain a level of 60 is using 30,000 a day. Most normal humans, and this is only most, usually wind up at around 8 to 10,000 in the winter, half that in the summer. But there were some of them, about 1 in 50, that needed tiny little doses, and it didn't have anything to do with anything else, okay? So this is a complex science where there is almost no clinical reporting of this is my clinical experience giving X dose and measuring the levels, because we're at this weird place where clinical observation is not valued. So if I try to publish a poorly designed, not case-controlled study, but this is the very beginning. No one's ever actually measured what the D level is that makes sleep better. And we're all desperate, but I haven't even tried to, I published it as a medical hypothesis because it really is a hypothesis. But finding when I go to the meetings, other clinicians come up to me and say, you're absolutely right, this is what I find. But in terms of getting the actual chutzpah to get up there and publish an article saying these are the clinical observations. Currently, my Right Sleep for Clinicians course that we're going to talk about, where I teach people how to, my American Academy of Family Practice will not give me any continuing medical education credits for anything that has vitamin D on it. All the other parts of the course, and their very first, so they're actually functionally suppressing education about this because it is not current accepted medical therapy. Well, it's not currently accepted. It's never going to be if you don't teach the doctors about it. So vitamin D is attached to everything about our body. So in the background, what happened to that gal was we went up on the dose higher. We found out all sorts of things about what happens when you're in the summer. What happens if I think I'm a really outside person, which is the way I look at it. Okay. And I actually go outside and I don't take D and my level drops back to 35 again. And I'm like, damn, what does that mean? Okay. Does that mean I'm not, well, it means that the amount of outside life we have is nothing like it was in the past. We don't really get up and walk outside. I'm not sitting out on my patio now. I'm doing that in the summer, but I'm not sitting right in the sun as I'm talking to you like I would have been when I was raising my sheep, in the past. Okay. So we clarify that this level is for better sleep. But the most important piece of this little introductory lecture is it all fell apart. So right around the time that Walter and I published that, I stopped sleeping as well. I have restless legs, which is my sleep disorder, which is why I'm so actually revved up about this. I'm still trying to fix it. And all of my patients start coming back and saying, I used to be much better. Now my butt hurts, my legs hurt, my foot hurts, I just been told I have lupus. All these things start coming back. The D level is still perfect. And I don't feel like, ooh, I'm doing something that's really out there. And it turns out that what's happened, I'm going to give it to you as the final answer. What happened was our microbiome requires D. So luckily for me, microbiome became a big, big deal by that time, early 2010 through 2018.
Yeah.
And we're starting to trade, recipes for probiotics. And it turns out that this D deficiency also affects the microbiome. That means the epidemic of D deficiency is not just about D. It's about anything that the microbiome used to do for us. We don't have that. And it turns out the microbiome, one, makes the 8 B vitamins. Those 8 B vitamins are actually first published in the 20s and 30s as bacterial growth factors. I mean, if you go back into the history of this, it becomes obvious that somebody figured out, like vitamin A, and then there are 8 things called B. Like, what's up with that? Why would there be 8 things called B? That doesn't make any sense. It took me years to actually, wait, I never even thought of this, okay? Somebody back in the past realized that, one, they came from a bacterial culture. You actually cultured the bacteria, and then you made the observation that, when I boil this liquid that has bacteria growing in it, then I can't get these little yellow guys with the black tips to grow in my Petri dish. I wonder if there are factors in there that are helping them grow. So the idea that there were essential elements from the surroundings, in the background, it meant you had a symbiotic foursome of phyla of bacteria. One of them makes thiamine, and this other guy needs thiamine, and the other one makes riboflavin. So they make these 8 chemicals, and that 8-pack of the chemicals are called the 8 B vitamins. Those bacteria that normally live inside us when we have a D level appropriate for living outdoors would have then provided all the raw materials we need, like every other animal out there that doesn't go to GNC and get supplements. The squirrels are not out here with little signs saying, give me my zinc, okay? Our biology actually came second to those bugs. Those bacteria have been here billions of years before we came. That means the first step is understanding that when you get D deficient, you are now B vitamin deficient, and several of the Bs, not just B12, but thiamine and another one called B5, who everybody has ignored, play a huge role in making the neurotransmitters that allow us to sleep. That means D was the answer for a while, but as you slept better and asked your body to make repairs, which is what we really want to happen, we don't want to just be unconscious and lie there like a lump. We want to do stuff to make us feel better. You use up your B stores. We are told that bees don't hurt people. That's a lie. We're told we don't have stores, that you can actually just give as much as you want and everybody be okay. That is completely wrong. So those original studies were done in people who had normal microbiomes back in the 80s. Now, everybody who's popped out by a mom who has a D that's below 40, they don't start off their life with a normal microbiome. And therefore, many of the things about neurologic development, both in utero and in early childhood, are linked to these things that are being provided by mom's microbiome when they're in utero, and by the baby's microbiome as they're growing. The second really important piece is the cannabinoids, which have also been vilified and ignored, are actually provided. So we have cannabinoid chemicals that we use for neurodevelopment and for a normal nervous system. The building blocks for those come from the bugs. That's just been shown in 2020. That means when you lost your microbiome, you lost the supplier of this important part of your neural development that has been shown to be linked to autism and several other things. So when you lose the microbiome, 3 major things are lost. Our ability to absorb and not overabsorb most of the small charged ions, iron, copper, manganese, all of these cofactors that are needed for various enzymes. The bugs have always played a role in those minerals being absorbed normally. They don't just sit there, they actually secrete chemicals that we absorb and play a role in our ability to notice, do I have too much iron? So the first article that really shows that the microbiome is involved in making sure that we have the right response to low iron. So there's actually a messenger that's extremely complex that's telling the bugs whether or not I need to absorb iron, and it also talks about whether or not I'm in iron overload. That means that microbiome has always played a role in that. You have to view it through an evolutionary lens that says every single animal on this planet has these little enzymes that need one copper molecule or one zinc molecule. Somehow they've been managing it without us smart doctors helping them. It was natural and it just happened. So when you lost your D, the microbiome went away. And what I then learned was, in order to bring back the microbiome, which you must do, so the sleep is dependent on the microbiome directly as well. So you have to not only give D, but you have to give this stuff called B50, which is 50 milligrams or 50 micrograms of every one of the Bs. So the only thing I remembered from medical school was, if you give one B, you should give all of them. And I don't even remember how I remembered that, but I just went into the store and said, wait, I'm about to give these B vitamins. I don't have time to tell you why I got into that, but it turns out there's a way to convert the microbiome, but it's not about dumping lactobacillus, a specific species. It's about getting the right growth factors for them, their requirements, until the 4 healthy, happy phyla are able to come back. Once they come back, then you have to stop the additional Bs, because our nervous system was actually created around their natural production. We only need the amount that they make, and then the vitamins do really bad things to you.
So then at that point, so you're taking another blood level check of at a certain point after they've been on the B vitamins for a while to see what their levels are?
Here's the problem, Amy. I've been fully trained, as have you, that we take these blood levels and then we do things with them. And for D, we're using that because we still need it. But for none of these B vitamins, except for B12, is the blood level in any way related to what the neurologic symptoms are. They are not. If you've ever gotten into this a little deeper, like magnesium blood levels have nothing to do with what your cell needs. And it has nothing to do with what your cells in the brain need, because even if you did the blood level, it wouldn't be about the CSF or the central nervous system area. So the other thing that's really creepy about this, that makes it very difficult to sell to physicians and even to lay people, is the only way you know if you're deficient in some of these things is by what your body tells you, which sounds totally flaky, but frankly, I had to learn that over time, because I would be saying, hey, I'm the doctor, I've got the piece of paper, it's got the lab results, I must be right, okay? And you must be the stupid patient who doesn't know that your body just said, I don't feel good, I don't feel the same. And I actually had to learn that most of the time, if I was gonna have a debate about, I think your D is too high, I think your D is too low, the patient would usually be right. And they couldn't even tell me exactly what it was, but they just had this feeling, okay? That is absolutely the same for the B vitamins as well. There is scientific literature that shows that the blood level has nothing to do with what the B stores are like in the body. Now, what that leads us to is a very complex picture. Learning how your body talks to you about this is very complex, okay? What my answer to that has been, one, to try to be, I have a website, not because I intended to do this, but because no one else is talking about it. And the need is overwhelming, okay? It is, everybody needs to know about this. Were my colleagues interested? No, they're still not interested. The vitamin word comes out of my mouth and they just like eye roll, she's gone over to the other side, okay? So frustrating for me, because this is the basis of biochemistry. Like, I'm showing you these biochemical pathways and telling you that when your D goes low, eventually your bugs go away and you become deficient in one of the most commonly used neurotransmitters that runs the parasympathetic side of the autonomic nervous system. So all of these things that we're learning about breath, about exercise, about meditation, dialing up the parasympathetic side, they're all valid. But if you run out of the juice, that stuff, if you have a deficiency state where you can't make acetylcholine, which is clinically how this presents. And interestingly, there are a whole bunch of articles now that if you just type in cholinergic deficiency disorders into PubMed, they're all over the place. ADHD, cholinergic deficiency at nicotinic receptors, Parkinson's disease, Alzheimer's disease, autism, there are scientific reports that show that we're acetylcholine deficient in the brain. So I stumble into the pathway that allows us to become acetylcholine deficient, not even knowing that these are well-reported syndromes.
Yeah. That's fascinating. And I just want to touch base on one thing you were going through is when you were saying you have a bad microbiome that leads to 3 problems. And we touched on the inability to absorb or not overabsorb small ions. And then was the other 2, was that related to vitamin D and
So
sleep?
3 things that are relatively unique that I've observed in my clinical, that's really doesn't address the 50,000 other things that all the scientists are writing about. If you don't have the right microbiome, then these are the things that happen to you. The things that are clinically most important are things that are linked to the B vitamins, which autoimmunity and allergy are directly related to acetylcholine in the background. So the 8 B vitamins, B5 in particular, is really the raw material needed to make acetylcholine. So you're missing the B vitamins, you're missing the endocannabinoids, which is why cannabis is what people are reaching for their pain. In some people, their major deficiency state is the cannabinoids. That's why it's completely unique. There isn't anything else that copies it. And then the third piece is, it is my clinical experience that suggests that many of the ions that the naturopath and the functional medicine people measure, so you're zinc deficient, or you're copper deficient, or you're iron deficient, those are all run by the microbiome. And they were being done without our consent and without our understanding. And it's not simple as we just absorb, it's they detoxify us. Why is it that I have mercury fillings and I don't have a high mercury level, whereas the next person does? And it's linked to this.
Okay. This is all fascinating. And I want to take a few minutes at least to touch on your Right Sleep program, because I know part of what we just talked about goes into that program to help people. And I want to share it so people can start jumping into it and getting some benefit.
Okay, so the first part is I am very interested in the why of all this, and you clearly are too. I want to get back to the why, all right? I want the biochemistry. And that piece is on my website. There are various articles in the about section. There are all these other that are really written for laymen. But the how, okay, I'm interested. I don't want to know the biochemistry. Just tell me what to do is in a workbook. And the workbook is important because it tells you exactly what to do. And the details are very important. And it is included, the second half of it is a journal. Because if you're using your physical symptoms in order to understand what your body is telling you, you must be writing stuff down once a week. So it has everything you need to do and a journal. Also, when you buy that, you're buying the Right Sleep program now. In addition to that, you are invited to a Q&A session once a month. You're also invited to a private Facebook group where people who are stumbling through this program or succeeding as stellar, just got my sleep better, can trade their experience. And then I have courses that are meant, some of them are for lay people. There's one coming up on March 10th that is called Right Sleep Go Deeper. That's really organized for a lay person if they want to know more of the science. In an hour and a half, I clearly cannot cover all the depth of this and how this reaches out into our children, our moms, all the different diseases. Every disease that's now become common is linked to this in some way. That sounds ridiculous, but it is. And then in the course that you are speaking to, clinicians who want a deeper feel for this, who want to learn how to manage D levels and to do this with another person to help them through the Right Sleep program, that is called Right Sleep for Clinicians. And we have a course coming up on February 24th and 25th. Both of those types of courses are accessible on my site, www.drgominak.com, under the courses section. And anybody can sign up for either one. You don't have to be a clinician of any kind to sign up for the Right Sleep for Clinicians course. And if you decide you want to have me back to talk about kids and moms, because there is from my point of view, it's so much easier to prevent this problem than it is to treat it. Once you have not been sleeping, there are literally millions of things that are not getting repaired in your body. Fixing that again by getting your sleep mechanism back on track is very difficult, and it's long. If we were to prevent this so that moms never have a low D, and the kid is born in a circumstance where mom's breast milk has enough D, then the kid establishes the right microbiome and never has a problem. Then we don't actually have to be fixing a disease that happened already. So that's a whole other hour that we could talk about once you kind of have the framework.
Yeah, I would love to bring you back to talk about that, because I know it does impact many, many of my listeners and just anyone in general. This has been fascinating, fabulous. I really appreciate everything you shared with us. It was wonderful. And thank you. You explained everything very well, so people who don't have the neurology background can even understand it. And this was wonderful. So I thank you for your time. Really appreciate it so much.
That's my intention, is I want everybody to know about this, then I become obsolete. I'm hoping that it'll happen soon enough that we can all fix what's wrong and to be happy.
Yeah, absolutely. And thank you all for joining us today. Please go check out Stasha Gominak's website, drgominak.com. Please go check out her courses. Jump into the one that's coming up for the layperson on March 10th. Please support her, because she is really sharing great information that's, it's hard to get out there sometimes. So thank you very much for your time, and we'll see you again next week. Bye now.